Dr. Hossami, I'm curious to know what types of treatments does Verita Life offer here?
Sure. The treatments here are, first of all, we always look for treatments which has a scientific proof and has a scientific base behind it. Nothing is, let's say, not approved or doesn't have any science behind it or anything like that. So, for examples, we have treatments categorized in many categories, as we always tend to kill or attack cancers from every direction that it can grow through. For example, like we use the chemotherapy, right, in this clinic, but we use it in a way that doesn't have the side effects or doesn't have these severe side effects or harming the patients as the conventional. Something like IPT, which stands for insulin potentiation therapy. The idea behind this treatment came from that glucose is the main source of energy, or sugar is the main source of energy for cancer. So what we do is we inject an insulin shot or dose. This dose it's based on the patient's body weight and blood results and so on. And then it works only within 30 minutes. Within this 30 minutes, we tend to lower the glucose into a point where we call it a metabolic stress. This is a level where the cancers are under stress. They are starving because of the low sugar, and it's the resistance of the cancer towards chemotherapy is decreased as well.
I found, reading more about IPT, I found it really interesting, the descriptions where they talk about, after the injection of insulin, the cancer cells become hungry.
Exactly.
Yeah.
So it becomes very weak as well. So here we tend to inject, let's say, between 10 to 25% of the conventional dose of the chemotherapy. So the effect of it is high because the cancer is very weak, and the side effects are very low because the dose of the chemotherapy is low as well. For example, we go with immunotherapies as dendritic cells and NK cells, and also viral therapy, immunotherapy as well. But let's say, for example, NK cells, these are the lymphocytes that we have in our body. Lymphocytes is a type of the white blood cells that are responsible to attack cancers and viruses. Mostly cancers, as we know, it happens due to a weak immune system. That means these lymphocytes are not functioning in the right way. So what we do is we train and we multiply these cells into higher numbers, which we make them able to recognize cancers and attack cancers.
So almost like increasing the army of the body so that it can be deployed out to kill what it needs to.
Definitely. Yeah. So it's a biological treatment. It's done outside the body and then it's given back to the patients. It has zero side effects because it's the patient's own cells, and the effect of it against cancer is quite high.
And one thing I find fascinating about this treatment is that we're not going and killing lots of cells, we're actually strengthening the immune system.
Cancers always happen due to a weak immune system. For example, every person has a possibility to develop cancer every day, possibly. It's a normal cell that started to multiply or started to function in an abnormal way, and this is what's cancer. Usually, our immune system should be able to recognize these cells and either repairs them and bring them back to normal cells, or attacks them and leads them through a programmed death so they don't develop a cancer. Once the immune system is not being able to function in this way, the cancer is developing. So at the end, a cancer is developing, or it is a disease of a weak immune system. So the main treatment for cancer is always to enhance the immune system, to train it back again, to be able to recognize these cancers and attack them or repair them. The only disadvantage about the immune system that it is a slow-acting system. It doesn't function in a very fast way as cancers multiplying in a very quicker way. So that's why we have to always use the treatments along with the immune therapy and the immune system to be able to suppress the cancer, stop its growth, and then allow the immune system to be able to start working and functioning in the way that it should be.
And I imagine that's why you want your patients to be present for that, 6 to 8 weeks, rather than, visit for a week and go back and come back later. You want some intensive treatment over a shorter period of time so that the immune system can really rebuild and do its job.
Yes. Yeah. Exactly.
Fantastic.